Hi, today we're going to discuss what you should do when you have shoulder pain. Shoulder pain can be very disabling and it can also prevent you from doing the things you enjoy doing. The shoulder joint is a very complex joint. The fact that it can give us a lot of mobility is part of the reason why there is so many things that can go wrong. So let's go through the causes that can cause shoulder pain. Number 1, rotator cuff injuries. The rotator cuff is the muscles that helps with rotation in the shoulder. A lot of athletes that do ball sports and racket sports use their rotator cuff a lot, and that can cause a lot of issues. Impingement pain. Impingement is not a diagnosis, but it's a secondary thing to what's happening with the rotator cuff. Impingement is when you feel like a catchy pain at the top of your shoulder. It normally gives you pain in front of the shoulder and it can shoot down the arm. Bicep tendinopathy pain. The bicep muscle inserts into the shoulder in the front and it can give you a lot of pain in the front of the shoulder. So when you pick up grocery bags and you feel pain, it can be the bicep muscle giving you problems. A frozen shoulder. A frozen shoulder can sometimes happen after a shoulder operation, or even just without anything causing it. A frozen shoulder is basically when movement is restricted and it basically blocks the shoulder and it freezes up. Ligament injuries. When you get a very acute injury like falling on your shoulder, you can actually tear a ligament in your shoulder and that can give you pain. There are many other causes that can also cause shoulder pain, but these are the most common ones. So what should you do when you have shoulder pain? The best is to go and see a healthcare professional. Physiotherapists are trained to evaluate the shoulder to determine which area is affected, and they can treat you accordingly. If you don't get better with conservative treatment like physiotherapy, your physiotherapist will send you to an orthopedic surgeon. They will do an X-ray, an ultrasound or an MRI to determine what is wrong. If you have a very acute injury in your shoulder, so let's say you fell on your shoulder, for the first 48 hours you can practice the RICE regime. So the most important thing with that is to put some ice on the shoulder for 10 minutes on, 10 minutes off. For chronic shoulder pain, you can try something like a hot pack. That will also help to decrease muscle spasm and to get the circulation going in the shoulder. Exercises. Exercise plays a big role in getting rid of shoulder pain. You can do stretches and strengthening exercises. So now you know what the causes are of shoulder pain and what you should do when you have shoulder pain. Next time we're going to go into more depth on some of the exercises that you can try at home. If you like what we do, please like our Facebook page and just subscribe to our YouTube channel. Please leave us a comment and tell us about shoulder pain. Have a nice day. See you soon.